There's a good chance you're alive because of the WHO. You know the name, the World Health Organization. But what does the WHO actually do? Because it doesn't run hospitals. It decides how the world responds to pandemics and health threats. The WHO is the global coordinator of public health. It sounds a bit boring, but it's saved millions of lives, maybe even yours. It tracks disease outbreaks, sets health guidelines, and it runs vaccination campaigns. It helps countries build health systems, especially during emergencies. So, for example, when Ebola spread across West Africa, the WHO helped contain it in under a year. That means you didn't get it. When COVID hit, it coordinated vaccine access to over 100 countries. When there's a new virus that appears, it is usually the WHO that sounds the alarm. But the WHO has no enforcement power. It can issue warnings, but it can't force countries to act. And most of the budget is voluntary donations from rich nations. That means the biggest donors can influence who gets prioritized. In theory, the WHO is neutral. In practice, it answers to funders. And that's where the conflict begins. Some say the WHO was too soft on China during COVID. Others say the US tried to control the response. Western nations ban transparency, but many countries prioritize national image, local control over global reporting. It's high context versus low context communication. Different cultures, different expectations. So, what does the WHO really do? It warns, it advises, it coordinates, it saves lives, but it does not force nations to comply. And that may be why it has not saved more lives.